After I finished my orthopedic residency in New York City, I knew that I wanted to subspecialize in pediatric orthopedics, so I came to the Shriners Hospital in Tampa, where I did a pediatric orthopedic fellowship. And then upon completion of that fellowship, I found this practice here in Orlando, and it was what I was looking for, and it was a good fit and worked out well. I am a specifically pediatric orthopedic surgeon. Most of what I see is what we consider community orthopedics, young children with fractures, infants with foot deformities, sometimes hip deformities. But the majority of my practice really would be minor fractures, teenagers with scoliosis. Most of the fractures that I treat are treated with casting, bracing, or simple immobilization. On occasion, we do run into fractures that require surgical intervention. There are non-fracture patients that I do see on a fairly regular basis, and one of the more common diagnoses for this patient population would be a patient with scoliosis. And a patient with scoliosis can be treated either through observation, bracing, or sometimes surgery as well. It depends on the degree of the curvature that the patient has. So within the scope of my practice, I treat both operative and non-operative orthopedic conditions. I grew up in upstate New York, so I'm very familiar with the cold weather. Then I did all of my training in New York City. Once I came to Tampa, I really enjoyed the Florida lifestyle and Central Florida. In my spare time, I do quite a few things, but my primary interest is collecting antiques. I have a toy collection. I primarily focus on toys that children used at the beach in the 1920s, 30s, 40s, and 50s. So I do spend a lot of time perusing antique shows and markets. I think the most rewarding thing about being a physician is watching the children heal, get better, move on with their lives, and I've especially enjoyed watching several of my patients now grow up, as at this point I've been here 13 years, so some of the children that I've had in my practice from the beginning are now off into college. I think it's fun to hear what the kids are doing. I enjoy hearing their stories about their injuries, the details of the injury from their perspective. I love having them tell me what they did and didn't do while they were being treated and while they were recuperating, and just seeing the medicine from a child's perspective. I think it's important to look for someone who's had subspecialty fellowship training. There are orthopedists in the community who do treat children. However, I think for a specialized pediatric problem, it's most appropriate to seek treatment from someone who's been fellowship trained in pediatric orthopedics. And I think it's important to look for a physician who is really willing to interact one-on-one with not only the patient's parents, but the patient themselves, keeping in mind that the patient really is the child.